Hi everyone, it's Dr. Jen, your midwife, here on my way out of the clinic on Christmas Eve. And I'm very excited to get home today and enjoy some time with my family, but a quick message first. Maybe it's more of a venting for me. I saw a woman today with a 2-week-old baby. At 1 week postpartum, she had to be admitted back to the hospital because she had an infection of the uterus. And this can be very serious, and it requires IV antibiotics and oftentimes treatment in the hospital, sometimes overnight. And when she went into the hospital, she saw the doctor in the emergency room, she was told that she had to stop breastfeeding because of the antibiotics that she was going to be given while she was in the hospital. When I saw her today, I looked back at the antibiotics that she was receiving, and the fact of the matter is this wasn't true. The antibiotics that she got were safe for her baby while she was breastfeeding. And I think sometimes as providers, we forget how vital these first couple weeks are of breastfeeding and how much damage we can do if we tell a mother that she needs to either stop breastfeeding or that she needs to pump and dump her milk because of the safety of medications that she's taking. Because of what she was told, this mother completely stopped nursing and pumping. And so before I saw her, she had already gone for over 24 hours with no removal of milk at all, no breastfeeding, no pumping. This can really sabotage her milk supply in a very serious way. So I want to say to all the parents out there, if you have any condition where you have to be readmitted to the hospital or at any point during your breastfeeding journey, you need to take medication. I think it's very important to get accurate information about the safety of that medication. You can get that through an international board certified lactation consultant, an IBCLC, at the hospital where you're being treated. Most hospitals have IBCLC programs if they're in larger cities or more populated areas. If you don't have access to that kind of assistance, there is a really excellent app for your phone. It's called Infant Risk. I believe it costs about $10 for a lifetime, so it's not free. But it will give you accurate and up-to-date information on the safety of medications in pregnancy and breastfeeding, and tell you the studies that have been done on those medications and what the basic risks appear to be, if any. And providers, if you are treating breastfeeding women, you need access to this up-to-date and reliable information about how safe medications are for breastfeeding. Because this woman, her milk supply may never recover from this event. And in my opinion, the responsibility for that lies completely on the provider who told her that she couldn't breastfeed while she was taking this medication. The benefits of breastfeeding her baby are phenomenal, and that would be a huge loss for her, and that's really unacceptable. So providers out there, I challenge you, do better. Get up-to-date, accurate information about what's safe and what isn't for breastfeeding mothers. I know we're inundated with information that says nothing is safe. Every time we place a medication order in our computer system, it gives us a red flag if someone's breastfeeding, but we need to go above and beyond and to really understand when someone actually stops breastfeeding or needs to pump and dump milk for a certain period of time in order to keep their baby safe.